we have very limited data on COVID-19 and cancer. There's a very small case series from Wuhan that was, I think, put out in preprint or published about a month ago that says that people who are on active chemo seem to do a little bit worse. And of all the people, it's people who have lung cancer and hematologic cancers. Those seem to be people who seem to do worse with COVID. What that means, we don't know. I think that people who are I mean, clearly, if you're under active chemotherapy, it's hard to know what's going to happen. But I think if I explain a little bit more about what a lot of us are starting to think, or at least some of us are starting to think about what's going on here, it'll make a lot of sense. But most importantly, the thing I tell my patients, and again, those of you who know me, I'm a breast cancer doc, and people who've been through chemo, they're probably okay. People on tamoxifen or Arimidex or anastrozole, they're probably okay. And active hormone therapy, because you get these very nervous things. Oh, I've had breast cancer 5 years ago. Am I in trouble? And the answer to that is generally no. But on the other hand, if you're under active chemotherapy, you got to be careful. A lot of our patients actually are older already to begin with. A lot of our patients have diabetes. A lot of patients have hypertension. A lot of patients are men. These are COVID risk factors. And so these are things you have to think about when you treat them. These are for anybody, but I think that at least for cancer, that's kind of how we think it. And I think, what we've done, for example, is that we give a lot more weekly, like, the standard adjuvant regimens are dose dense ACT or regular dose ACT with weekly paclitaxel. And so what we tend to do with a lot of our regimens is I've been giving the paclitaxel first. That way, even though they come in every week, I know their counts are not going to go that low.